Hello everyone, my name is Venkaya Parakala. Today we'll be discussing about the business impact of medical impact on all the Medicare for all the US healthcare systems. So this research explores how Medicare for all a purpose healthcare reform to transform the way healthcare is financed and delivered in the United States. My name is Venkaya Parakala and I am excited to dive into the complex and critical topic. Introduction to Medicare for all. To begin, what exactly in Medicare for all? The proposal aims to expand the current Medicare program to cover all the US residents, replacing the private and employees sponsoring insurance with a single government administered system. The main goals of Medicare for all to ensure universal access for the healthcare, reduce the cost for both patients and providers, and streamline and financing process. The US healthcare landscape addressing the major issues like healthcare accessibility, cost, and gaps in coverage. Focus area and rationally. My research focused specifically on healthcare financing and reimbursement models impacted by Medicare for all. Currently, the US healthcare system is multi-payer system which provides the various and public insurances funding healthcare systems of the all the shift and single payer model. Funding primarily through the taxes. The focus of this critical because it's directly impacts on the healthcare providers, receive payments, and how healthcare services are priced, and how accessible these services to the public. Understanding this change is financing is essential and evaluating the potential success of Medicare for all. Overview of Medicare for all. The objects of Medicare for all straightforward but transformative. The reform aims to reduce the healthcare costs by eliminating the private insurances, administering the fees, and ensuring everyone has coverage and focusing on preventing care. Medicare for all could significantly reduce the bureaucracy in the healthcare and allowing providers to spend more time on patient care rather than the dealing with insurance paperwork. This could improve the efficiency and streamline of healthcare delivery. Systems framework analysis, financing. It looks like Medicare for all throughout the system framework, which breaks down the healthcare system into a financing, delivery, and regulatory components. First, financing under Medicare for all could funded entirely through taxes, eliminating the need of private insurance. This centralized could be reduces the cost through the requirement substantially public investment. Finally, in public and oversight, the government play a larger role of regulating and standardizing the care of, including setting reimbursement rates and ensuring the quality. This increased the regulatory control aims to ensure equal access to highly healthcare and regardless under socio-economic economic status. Strengths of Medicare for all. There are several strengths to Medicare for all. First, it would provide a universal healthcare coverage for all Americans, which would eliminate to coverage the gaps we currently see, with no premiums, debuts, or co-pays, financial barriers for patients, which could be drastically reduced. Prostitute is another major strength. The single-payer model is projected to save on administrative costs as it is eliminated the need of multiple insurances and reduces the redundant administrative tasks. Additionally, Medicare for all places a strong emphasis on preventive care, which could help prevent costly chronic and conditions and improve the overall public health care outcomes. With prevention services covered, people would become more likely to seek early treatment and maintaining of the healthier lifestyles, reducing long-term healthcare costs. Challenges of Medicare for all. However, implementing the Medicare for all would not be without a challenge. The most significant barrier in the high cost implementation, transforming the entire healthcare financing system requires an enormous initial investments and the taxpayers would need to shoulder the majority of their costs. Another major challenge is political opposition. Medicare for All also faces the operational challenges such as the potential wait times and the provider shortages due to increased demand. Without more people accessing services, wait times could increase and provides the capacity may struggle to keep up. Comparison with previous approaches. To better understand Medicare for All, let's compare it with the previously healthcare approaches, specifically the Affordable Care Act (ACA) and private insurances. The ACA expands the access to insurance, the mandating coverage and providing substances, but maintained the multi-payer system with the private insurance. In terms of market justice, whereas the social justice provide the insurance in a basket for marketing justice. Additionally, economic principles like supply and demand, market failure, and moral hazards are crucial in these discussions. Medicare for All addresses supply and demand issues the healthcare by providing the universal access, but it may create moral hazards concerns as low of pocket costs and to encourage the overuse of these services. Informational interviews. As part of the project, I conducted informational interviews with the professors in the healthcare field to gain real world insights into the feasibility and potential impacts of Medicare for All. First, John L. Jabrowski, a CFO in healthcare, high insights of the financial adjustments healthcare systems would need to make. Michael Cook, MD, shared her views on how the shift to a single payer system could impact the quality of impact care and provider workflows. Finally, Emma R. Perudo and the healthcare analysis discussed the regulatory and policy changes that Medicare for All would require, as well as expected to push back from previous for various industry stakeholders. Conclusion, personal position. In conclusion, Medicare for All potential to revolution healthcare in US marketing more accessibility and affordability. However, the implements they going on. The success is such a system would depend on heavily and carefully planning and gradual implementation to avoid overwhelming the current system. Thank you for your attention and welcome. Any questions?